Time now for this week's Health Matters. Lynn Szabo, PA, in the studio today, and along with Mike Thornton, we're discussing some, of course, more COVID stuff. So I've got a scenario to run by you. My eldest had, it was either Delta or pre-Delta COVID in New York last Christmas. And just was in her apartment and with her boyfriend, and they holed up there, and it was a mild experience for her. But ever since, she's had tinnitus. She's had ringing in her ear, and she said that's the only thing she can trace it back to is the bout of COVID.
Right.
So is that a part of long COVID? Is that a little tiny part?
Certainly could be, because that, to me, that implies a couple of things: an anatomical problem or a neurologic problem, or maybe a combination of both. And microclots are kind of a thing, like we're going to talk about here.
Okay.
And a lot about post-COVID isn't really known, even in mild cases. So, I think she should go to a good otolaryngologist who has some COVID knowledge.
Wow, okay.
And that's going to be a challenge, because a lot of what we are going to understand about COVID in the future is not really understood currently.
Right, exactly.
And you'd be shocked at the number of providers that they're not just behind the curve, they're just apathetic. They're overwhelmed and they've checked out.
Oh, wow. So like not enough wherewithal to even think about, all right, what's going to happen 2, 3, 5 years down the road with this, where they're too busy in the moment dealing with everything that's going on? Okay.
And I think the plan is to send those kind of odd problems to specialized COVID clinics.
Wow.
And fractionate medicine yet again. So
today's topic, long COVID.
Long COVID, which is kind of maybe what she has, actually.
Okay. Well, what do we know about long COVID?
That it's terrifying. So long COVID is, we call it post-COVID syndrome. So it's a broad range of symptoms, and it starts, and the symptoms have to persist 3 months after the onset of the person's COVID experience.
Okay.
So it also has to be not attributable to any other pathology. All right. And let's be clear that it rarely happens in people who are immunized and who get breakthrough COVID.
That is something I had not heard about immunizations and the effectiveness, the efficacy thereof, is that it actually also applies to long COVID. Wow.
Yeah.
Okay.
Yeah. So physical symptoms include, it's widespread: fatigue, dyspnea, chest pain, and cough, and then less commonly, loss of smell, joint pain, headache, dry mouth, and eyes, poor appetite, dizziness, rapid heart rate, hair loss, sweating, and diarrhea. So, I mean, like just about everything.
Or as I call it, a Saturday. But
Yeah.
No, that's sorry. There's just a lot of like that. That's such a widespread sort of panoply of what ordinarily could be almost idiopathic sort of things, right? Where how do we put all these disparate things together? Right. Wow.
And then a lot of people gets labeled as depression. Okay, bye. Here's your Prozac. Okay, bye.
Wow. I may be jumping ahead, but is there any understanding how this virus causes all of these symptoms?
Yes, it's an inflammatory virus, so that I think explains the widespread. There's problems with microclots, and so I think that explains kind of the pulmonary stuff. The other stuff is it apparently affects the autonomic nervous system, and I'm going to talk about this in a minute, but that's kind of hard to diagnose. And I think that would explain like the sweating and the diarrhea. So autonomic nervous system is the part of the nervous system that's kind of on cruise control. We don't have to think about it. It just kind of happens. It keeps us alive. So
the part that makes your heart beat.
Yeah.
Okay, yeah.
Stuff like that. That's why rapid heartbeat is kind of a deal. Dizziness is kind of a deal, and it's that dizziness is oftentimes orthostatic. That means it's secondary to changing positions.
Okay.
So I think there's probably a wide range of explanations for it.
But again, it all goes back to sort of that base, the foundation
illness,
of inflammatory problems, because that would affect every system in your body.
And this is sad. Psychological and cognitive complaints, including memory loss, anxiety, and depression.
Wow.
Let's just be clear that this is happening in people who only have mild symptoms too. So, anxiety and post-traumatic stress is certainly a byproduct of, say, being on a vent or in an ICU.
Sure. Right.
Having your mortality directly threatened. But this seems to be happening to people who've only had mild cases. So out of the people who have long COVID, 40% of people are unable to return to normal activities 60 days following hospitalization. So this is looking at people who are hospitalized.
Do we have any sort of number for just, of all the millions of people who have had COVID, like the prevalence of long COVID coming out of that
I think
pool?
it's really unknown.
Yeah.
And I'll talk about with my experience with it here,
Okay.
and why I think that might be unknown. Kids are less effective, which is good because
Kids are also wildly ineffective,
Yeah,
too.
but a lot are hospitalized right now with Omicron. So because they can't, especially the youngest ones, they can't be immunized.
Mm-hmm.
So symptoms can be improved with vaccination, and I have seen that done done with the cooperation of a couple of patients who might have had long COVID.
So vaccination that follows along after initial
Right.
illness? Okay, okay.
But it's fair to note that vaccination worsens symptoms in about 5%.
Eee, okay.
And I would say that about it, the 5% got worse, and out of, let's say, the 95, about half got better, and about half stayed the same.
Okay.
So a lot that's not understood.
Now, 5% of an affected group, right? Is that a statistically significant number? I mean, all statistics are significant depending on how you look at them, but 5%,
Sure.
is that enough to make you go,
Yeah, I think it should be because of the numbers of people that have had COVID. I mean, you could look either at the United States or worldwide. And, there's people that have recognized COVID and people have unrecognized COVID and people that were never diagnosed. The people have died never being diagnosed.
wow.
So the numbers are kind of not super reliable.
Right. So I guess what I'm asking is how much credence should you put on something like that 5% number? If you're facing that decision to be vaccinated, you've got COVID, you've got long COVID.
But I think you look at the relative risk.
Sure.
So if about half of the 95%, let's say 47%, were helped by it and 5% were worsened, I would go for it.
Yeah. Okay.
Yeah.
Okay.
Hospitalized people had the highest risk of persistent psychological symptoms. And I think that's just the stress of being in a hospital. So here's what I'm kind of coming into realization. Just, I have to say that doing these talks really ups my game as a PA because I spent a lot of time researching stuff online. And I will say I got this information from Up to Date, which is the most, it's up to date as of the 21st of December, 2021. So this is like hot off the press. I think I've been seeing it and not
Seeing it clinically here locally?
Seeing it here locally.
Why do you say that? What sorts of things have you been seeing?
Well, I've been seeing people that have the dizziness when they change position. They all of a sudden get rapid heart rate. I've seen the cognitive dysfunction. So problems with their thinking, memory loss. And they don't always tell me they had COVID. And this is what kind of scares me a little bit is I don't always know. Because right now, what are they saying for people who have COVID? So if you're diagnosed in the COVID tent, if you get a positive, and let's say you're a patient at Del Norte Community Health Center, but maybe you got your testing at another site, I don't think that information transfers over to your provider. And I will say that maybe this was just my fault as a provider not paying attention to it, but I think I'm one of the most COVID obsessed providers probably in the community. When somebody comes in a couple months later and they're having rapid heart rate or kind of chest pain and shortness of breath, let's say in a young 25-year-old female, that's in most providers' minds, that's kind of anxiety until proven otherwise, but maybe it isn't.
Okay,
So-
gotcha, yeah.
I think that if you're having those symptoms post-COVID, you have to make sure that don't assume your provider knows that you've had COVID.
Right.
Okay. I think you have to bring it up. Otherwise, it's going to be, here's your Prozac, okay, bye.
This ties in with so many conversations that we've had over the past few years with this, just about being your own best advocate. You are essentially the seat where all your information sits. They don't access it when you walk in. I always thought that's how it worked. Nope.
No, that was the electronic medical records thing was sold partially on more complete records, but actually it's more fractionated. But that's for next week. So I think you should make sure that your provider knows you had it. I think you should make sure I think it should occur to you and in providers' brains that post-COVID is a thing. And I think we're seeing it without really properly recognizing it.
Are most health professionals recognizing that post-COVID is a thing? I just wonder about that because I've heard different sort of analyses of that.
So it depends. Are you talking about Del Norte?
Well, Del Norte would be a place to start, but I think it might be bigger than that. I don't know.
I think maybe if you were in San Francisco, let's say at UCSF, then yeah, people would be totally on it. I think if you were in Del Norte, and talking to somebody whose practice hasn't changed very much in a long time because they're overwhelmed and they're just skating to the weekend, maybe not. But that, I don't mean to sound disrespectful or get too political, but some people, this is overwhelming to providers. That is very clear in the news, and some people have just kind of tuned it out. So, I don't know. I mean, I'm kind of obsessed with it, and I don't think I've had the recognition that I should have.
Well, I think I mean, just with all of the stress, I think, of being a healthcare professional in general, then all of this COVID, then it starts morphing, maybe that's the wrong word to use, but into this long COVID, and I'm just barely keeping up.
Right.
I don't really know what to do about it anyway,
Right.
and just kind of like
Right.
giving up.
Well, what I found when I was reading this up-to-date article, which is the singular reference that most healthcare providers in, I would say, Del Norte and Humboldt County use, is that there's a standard follow-up that should be happening after somebody's had COVID, whether they've had a mild case or a severe case. And I'll tell you, none of the clinics, that hasn't occurred to anybody. But they're talking about standards of care for COVID follow-up that sound to me like are not being followed up here. But I also think that what's going to happen is that it's likely there's going to be specialty COVID clinics or maybe a specialty COVID provider. And they're talking about using telemedicine to monitor people in a routine, established, data-driven way after they get over COVID. But I don't think it occurs to people that they need that. I would say a lot of people who get diagnosed with COVID are really shocked that it's a real thing, and then are shocked they're so sick, and then they're worried about their family. And by the time, they get through the acute illness, if they've had at all a moderate to severe illness, they don't want anything to do with medicine anymore. They're kind of done.
Yeah. So
I think providers have to get sparked on this. And, this really inspired me reading up about this. It's going to change my practice starting tomorrow.
How so?
I'm going to bring people in who have had it. I'm going to look for I'm going to screen for certain symptoms. I'm going to be more in touch with the infectious disease consult that UHS just hired, Uzi Seltzer, who's going to be working with UHS in 2 counties. I've worked with him before. He's an amazing physician, and I'll bet you he's up on all this. Maybe he can present something to the provider community at UHS that sometimes they have meetings where Del Norte Community Health Center providers are invited to. I think I'm going to be a squeaky wheel for a little bit until we get this ironed out, because I'm seeing people with these symptoms, and it's so easy to be overwhelmed and just blow people off.
If you can, and I know we ask a lot of you here, but if you could just keep track of those. I mean, of course, you'd probably be doing this anyway. Just keep track of those numbers. If you could come away from the next few weeks with some sort of idea about how widespread long COVID is just among the group that you'll be seeing, that would be really interesting to see.
You think I'm seeing it? I think I saw 2 last week, actually, that I probably didn't recognize.
Wow.
Management, and nobody knows what to do. So that's the other thing. So you're monitoring these people. You've got them kind of scared because you're reacting in an anxious way to their illness, and you don't really know what to do about them. So watchful waiting is kind of the treatment right now. Symptomatic, addressing symptoms like somebody with a rapid heartbeat would probably get put on beta blockers or something. But I don't think any of us have this connected or understood enough really to know what to do beyond that. So but the expectations include that people who have had COVID, even a mild to moderate case.
These are heavy.
These are
expectations. This is whoa.
Yeah, this is expectations there that include permanent lung damage.
So this is if you've had COVID and have moved it consciously that you know of into long COVID. These are kinds of the things that you might be facing.
If you have had COVID and or you've progressed and maybe have a long COVID situation, doesn't have to be long COVID.
Okay.
But you can have permanent lung damage. You can have clot problems. So I've seen a little uptick in the number of pulmonary emboli that people are getting. It's mild, but I think as a provider, it's kind of increased my awareness of it, which I hope is helpful. You're going to have problems with cognition right now. I can't, other than Patel's office in Brookings, there's nobody that is made known to me where somebody can have their cognition tested.
Right.
A need for specializing testing to find the neurological complications. So this dysautonomia, a problem with the function of the autonomic nervous system is super hard to pin down.
And extremely worrying.
It is. It really affects people's lives.
Yeah.
So 40% of people who have long COVID can't go back to normal functioning after 60 days. That's like a huge big deal.
Well, I know I've heard anecdotal studies about young athletes who, after COVID, have had a tremendously hard time getting back anywhere near to where they were. And these were people,
with the top form, right?
Right, yeah, ostensibly in, really, really good health and all of that.
Right. And so I think there's going to be a need for, I did send somebody to a cardiologist who was on it and who was really aware that the woman had COVID. And I think she had the problem with the autonomic nervous system because she had kind of shortness of breath and tachycardia. But before that, there had been a number of physicians who told her she had anxiety.
Oh, yeah.
Of course she did. She couldn't breathe. But
and again, anxiety being one of those things that you can sort of pile all these otherwise might be idiopathic sort of concerns into this bag that just says, this is what it is.
And that's easy for a burned out provider to do. But what we're going to
need
need
a worried patient to buy into as well, right?
Totally.
Yeah.
We're going to need kind of COVID-aware cardiologists, neurologists, ENTs, because there's a horrible fungal infection that people get post-COVID.
Oh, my God.
Remember that was happening in India? They were getting like gross fungal things growing in their sinuses.
I missed that.
Yeah, it was for people who were on ventilators.
Oh, wow.
Because they had to reuse vent equipment in a way that it wasn't intended.
Oh, my God.
And who knows what it's going to do to kids, maybe over a kid lifetime.
Yeah, nobody knows exactly.
So anyway, we're going to need that kind of specialty care. And I think actually a physician, maybe who's like run-of-the-mill cardiologist, could probably even be a subspecialist in COVID cardiology. I think it's going to become that specific.
Wow.
And I don't know how I refer a patient there. I have no idea. Like zip.
I think one of the questions that just keeps going through my mind since you just said what you said is we don't know how many kids are going to be affected with this long-term COVID.
Right.
And at the same time, we're putting millions of them at risk of at least contracting the virus every day.
Right.
That seems problematic to me. I mean, I don't know if there's anything else to do, but
it's just exactly. That seems
problematic.
problematic.
Are the school psychologists up to date with how COVID can change cognition in a kid? There is no
Let's take a guess.
There is no up to date. That book hasn't been written yet.
Right, exactly.
Yeah, those protocols haven't been even conceived yet.
And Mike's talking about that seems problematic. I think we should take, E pluribus unum off the money and put that seems problematic. That should be our new motto.
Well, yeah. I mean, but it's just that we have all of these competing forces going on, and I mean, just here, kids are more and more kids, as far as I'm being told, are not being able to come to school because they're getting COVID again. There's another surge taking place, and at the same time, while I do understand that kids being out of school for long periods of time, there's problems with that too.
Yeah.
Right.
But then at the same time, if we have this whole other potential syndrome that we don't understand, I just don't know what, if anything, is being put in place to try to address that as we move forward.
I think that's what she's saying. That's what Lynn's saying. Is there's
I think
nothing
it
put
starts
in
with
place.
the awareness. I haven't seen that yet.
Yeah.
Only in one cardiologist have I seen that. But the other thing too is this is, as we go through the variants of concern, this disease changes almost to different diseases. So is Omicron like a no big deal on the long COVID thing? We haven't lived with Omicron long enough to really know.
Exactly.
But is this mostly coming from Delta? Hard to say. How about the original strain? Maybe that does it a little bit, and Alpha a little bit, but not so much Delta.
I mean, they were talking long COVID from the jump with COVID-19. It seemed like that was a concern right off.
Right.
This isn't the first time we've discussed long COVID.
But I think Omicron could be different. So if people are out there because the mom's keeping her kids home from school because they have COVID with Omicron. I don't know that this is terrifying. I don't know what long COVID is with Omicron. So, but I think you always ask, what can the average Delnorder do? So other than vaccinate, other than like wear your mask, I think what you can do is start to ask your provider if you've had like Delta or if you've had COVID previously and you have a series of oddball symptoms, or you're not feeling like your symptoms are being addressed, make sure your provider knows it's COVID and ask specifically if that provider thinks that long COVID could be at play here. And if that provider doesn't know, I would ask for out-of-the-area referral, maybe even to tertiary care. Tertiary care being like UCSF, UC Davis, OHSU. I bet Medford, that cardiologist who was COVID aware was from Medford, Southern Oregon Cardiology. And make sure that you're getting, if your provider isn't COVID up to date, make sure you're getting access to providers who are.
Yeah. Because it will be more and more of a concern moving forward. And again, we don't know how much. We don't know how big a concern it will be. And Omicron, I mean, everybody's got it. It seems like. I mean, we're still sort of treading water here because everything happens, It was like
Did you see Lost Coast Outpost, their little graphic that they have on their title page? You should check it out. It's like little wave of Delta, and then all of a sudden Omicron is like
right off the
just
chart,
a vertical line.
Really that much higher than Delta. Wow. Well, I know.
It's not only higher; it's the acuity of it. It's the rapidity.
Steeper.
Yeah. It's a vertical line.
Yeah. Wow.
It doesn't have a horizontal component.
I know.
Really.
And we're right on the edge of whatever whatever fallout will occur. Like I was just checking. So this week I teach a class at Pelican Bay. This week all programs were canceled for the time being. And there isn't an inmate yet listed on the CDCR COVID tracker as being ill inside. And the email I got, it wasn't because of inmate illness. It was because they just don't have the staff. So they're starting to be impacted out of Pelican Bay by not having enough staff.
Yeah, I know UHS in Humboldt County has taken some hits. The other thing, too, is I would ask you as a provider is don't come into the clinic with cold symptoms that you're hiding from us because you're afraid we're not going to address it. It happens constantly.
Wow.
And people will get in the room and their original appointment was their ingrown toenail, and they'll go, well, that's better, but I can't breathe.
Huh.
And so make sure that when you're scheduling an appointment that the front office knows that, and you will be diverted to the COVID tent and you will get excellent care. You will get excellent care. So it's not like we're just going to put the Q-tip up your nose and then walk away. We come out in our moon suits and we try and do as good an exam as you can do in the parking lot. And I insist on good vitals. I insist on a full exam. So nobody's getting shortchanged at all. Okay. And we're all trained we're actually in training right now to administer the medication that we talked about on this show. So that's we're going to have it in clinic and we'll be able to hand it to you.
Pavloxid?
Right. Yeah. Well,
yeah, but it's the antiviral therapeutic, right?
Yeah. I'm going to probably prescribe Paxlovid.
Paxlovid,
because
there we
it's
go.
more efficient or
it's easier
more
to
effective,
say.
But it's easier to say.
Right, yeah.
But the cool thing is all the community clinics are getting it and we will be able to hand it to you.
Wow.
Okay. So, but don't come into the clinic and make all of us sick. Not that, somehow we shouldn't get sick, but if we are sick, we can't give you care.
That's it.
So, and then all the other people who need care, like elders and newborns and things, are in the clinic. It should be a safe place to be.
Just to kind of follow up on what you were saying about being on the edge of the surge of Omicron, City Council had a special meeting on Friday in order to authorize, under the state's state of emergency, for them to do telephonic City Council meetings with 2 council members not in attendance already.
Oh, wow.
Yeah.
Really? Who are ill?
There were allusions to that, but no one ever actually says. It was Council Member Smith and Jason Greeno. I also wondered,
Jason Greeno, who works at the prison.
Frankly, I also wondered whether politically they didn't want to be part of a vote.
Good point. Right.
That said, we're going to roll back having in-person.
Yeah, because it
meetings.
makes that letter look really stupid.
It does make the letter look really stupid. But there was some allusion to that they may be ill, and or that ill council members can't attend these meetings, and so therefore, unless they're doing them, via Zoom from their homes, if they're in isolation, all the business of the city stops. And then I know there's going to be a COVID update at the Board of Supervisors meeting on Tuesday.
Okay.
Yeah.
Well, anything else, Lynn?
No, but remember last week we talked about universal health care? I think we should circle around. I've been looking at it this last week, too.
We have a bill proposed in California to provide universal health care for Californians. Medicare for all, I guess, is maybe what they're talking about. Yeah. The Redwood Voice team, Grant brought that to me, and he's already on it.
Yeah.
So he's following that already. But
That's awesome.
Yeah. So that'd be really interesting because, I think this this pandemic is certainly changing the way that I think that whole debate will occur in the future. Yeah. The context.
I still think it's going to be it's going to be a battle of capitalism versus public health. It's just going to be on a different front.
So I have a question which may not be able to be answered here and now, but maybe could be something for the future. Is all of COVID, regardless of the variant, kind of centered in this inflammatory disease thing?
Yeah,
because it seems like so much of the American lifestyle
lends itself to
lends itself to creating inflammatory conditions.
Diet,
and
increase in autoimmune
dialogue.
disorders.
Yeah, dialogue. Yes. Yeah. So it just sort of seems to me that, in some ways that could make our population much more vulnerable, perhaps than some others, and then also maybe is going to. Ideally, because you said it's going to be a battle of capitalism versus health. How do we move away from all of these things that cause inflammatory disease, but are really sort of designed to prop up big, agriculture corporations and meat processing.
Sure, I love
all of this stuff.
All this big stuff we're talking about, pandemic and history and society, and then boxes of mac and cheese and how they all come together.
Right, exactly, yes. And stress.
And stress, exactly. Yeah, right. Yeah, cortisone. Or cortisol. Is that what it is? What's the stuff, the stress hormone? Is it cortisol?
Adrenaline.
Cortisons are meant to alleviate your stress. Sorry. Okay, well, Lynn, anything else then before we call
but
it?
it should be an interesting discussion next week.
And a big high level one too. That's interesting, and I'll see about finding out more about the bill that's been proposed in Sacramento. All right, Health Matters only here on KFUG Community Radio with Lynn Szabo, PA, and I just want to point out 30 minutes to the second.
Bing.
Great radio, guys. Thanks. We'll see you next week.